We are talking about something very interesting here today with Dr. Stephen Bakir. He's an interventional cardiologist with Cardiovascular Associates, and he's here to talk about this new procedure. It's called TAVR or TAVR. Dr. Bakir, good to see you.
Good to see you.
So you take care of our hearts.
Yes, I do.
All right, what is this new procedure?
So the procedure is called TAVR or TAVR, and it's an acronym for transcatheter aortic valve replacement. And
I'm glad y'all did the acronym.
Right, exactly. It certainly helps me. And so traditional aortic valve surgery is when the patient's aortic valve deteriorates and we need to replace the valve. We have to traditionally go in through the chest with an open chest incision. And
very invasive.
It's very invasive, it's a long recovery time for the patient, and it's got increased risks. These are predominantly older folks because that's when the aortic valve tends to go bad. And in lots of that age bracket, these people are very ill and have other factors that make the traditional surgical approach risky. Right.
Oftentimes they'll have other things going on and you're like, you're not a candidate for that because of that.
Right.
So this can literally save lives, right?
It's absolutely a lifesaver, and certainly much easier on the patient because instead of the traditional surgical approach, we take a catheter and thread the valve, which is crushed on a little stent, up through the bloodstream, and we deploy it inside the patient's native valve.
So how new is this procedure?
So the procedure was approved in the United States in 2012. I started doing the procedure here in the Brookwood Baptist system about 3 years ago. We started our first structural heart center over at Princeton, and we've now blossomed, or to use the medical word, metastasized. We've started our structural heart center at Brookwood as well, so we have two centers that offer minimally invasive techniques such as the transcatheter aortic valve replacement. There are other minimally invasive techniques to not only place stents, which is well known, but repair other valves, the mitral valve, and repair heart defects, all going through the leg to make it much easier on the patient.
From your experience of doing both, when you first did this procedure, talk about what it was like to do it totally differently than the open chest.
It's a marked difference. So number one, you're doing something in a little bit of a less controlled situation because you're going through the blood vessel. You don't have ready access to the heart should something go wrong.
So there's still, with any medical procedure, there could be something could happen, but
there are clearly risks. These are patients who are not terribly healthy to begin with, and this procedure in particular is reserved for those folks who are at higher risk than average for traditional surgery. The procedure, though, when done well, is so much less dramatic. It's lots of people in the room. It involves a cardiologist and a heart surgeon working as a team, and so there's anesthesia in the room. But on the flip side, if it's done well, the procedure goes reasonably quickly, and the patient can walk out 2 days later with Band-Aids on their legs.
That's amazing.
As opposed to months-long recovery from an open chest surgery.
That's pretty amazing. All right, well, thank you for bringing us up to date on this. I guess if someone has that issue, you have a loved one, you can talk to your physician about that and see if you're a candidate for something like that.
Sure.
Dr. Bakir, thank you.
Thank you very much.